Okay. So, deoxygenated blood is being collected from the upper half of the body through the superior vena cava. Deoxygenated blood from the lower half of the body is coming in through the inferior vena cava. All right. So all of this comes back to the heart, and they're meeting here. Pull that back out. So back here also, you have the coronary sulcus or the coronary sinus. It's the same thing. It's just this cavity here, this depression, that holds coronary veins. So the coronary veins collect all this deoxygenated blood from the vena cavas, and it's going to go into the right atrium. Okay, let me get my cut heart out now. All right, hold on. Okay, all right. So you have the coronary sulcus on this one, or the coronary sinus, same thing, that's collecting all the deoxygenated blood from the vena cavas, which used to be here. So they're going to come into the right atrium, okay? And what this is this is the right auricle. It's like a flap that covers it. So this is the outer covering. The cavity itself is called the atrium. So this is the right atrium. So blood passes through the right atrium, and it comes through the tricuspid valve. So when this is closed, I don't want to totally close it, but when this is closed, it makes a circle, okay? And that's the valve itself. So it passes through the tricuspid valve into the right ventricle, okay? From the right ventricle, it passes through. All right, so from the right ventricle, it comes up this way. It passes through the pulmonary valve. That's the exit from the right ventricle. It's the only way out. So it passes through the pulmonary valve, and it comes up, and it goes through the pulmonary trunk. The pulmonary trunk is so tiny. So we're going to look at this one. So we're exiting the right ventricle. We're coming up through the pulmonary trunk. This is the pulmonary trunk on this one. You can see it a lot better. Okay. So this is exiting the right side, whereas the other big one that's coming out, it's more of like the center, which the left ventricle that it's coming out of takes up the majority of the heart. So this in the center makes more sense than this being in the center. Okay. So the pulmonary trunk, it's going to divide into two. Those are your pulmonary arteries. Okay, so the pulmonary arteries are carrying deoxygenated blood to the lungs. They're collecting oxygen, and they're coming back through the pulmonary veins. Okay, so the pulmonary veins go into the left atria, which if this is open, it would be right there. So the left atria, again on the other side, it's the same. It's right under the left auricle. Okay, so let me go back to my cut heart. So you find the left auricle, all right. Right behind that, this is the pulmonary vein that's carrying oxygenated blood. So leave my probe in there, and then I'm going to open it up. And you see now we're in the left atria in here. Okay. So it's going to pass through the mitral or the bicuspid valve, and it's going to go into the left ventricle. All right. So coming out of the left ventricle, we're going to pass through, you're going to pass through the aortic valve up there. All right, so when we close that, we're coming out through the aorta up here. All right, so that's the aorta. I'm going back to the full one again because this one has a better one. It's longer. So this is the aorta, okay? This big branch off of the aorta, the first branch. It has three, but you can only see the first branch. This is the brachiocephalic trunk. So brachiocephalic. Brachio means arm
and head.
Cephalic means head. So it's supplying the arm and the head. And that's just going to the right side of the body. All right. So this one becomes the common carotid, the right common carotid. Oh, they're loud. And then this one goes to the axial, right axial, okay, which is the arm. This continues over, and that's going to split into two more before it continues down. That supplies the left side. So one goes up to the head again, and the other goes to the left arm. All right, that's the path of blood. So a lot of this is, you have to kind of visualize, but you'll see it again next week too. So don't stress out too much about this. You'll see the heart again next week. So now we're going to go back through the rest of the stuff. All right. Okay. So the first thing we'll do, the interventricular sulcus. So that's basically the outside dividing line between the two ventricles. So you can see the left ventricle makes up a lot more than the right ventricle. Okay. Same on this one. If he has a cut heart out on the table, you just look for this big, thick dividing line. Okay. I'm trying to think what else. We'll do the tissues. Okay. So if we're looking at, this is one of the atria back here. This is the right atria. You see how smooth this muscle is? That's pectinate muscle. That's only in the atria. Okay. Once we get into the ventricle, you have the chordae tendineae, which attach from the valve to what's called papillary muscles. The papillary, they're kind of like fingers. They're like little finger-like projections. Oh, these are good ones over here. So little finger-like projections that are going to pull on the chordae tendineae. So that's what opens and closes the valve, is these papillary muscles pulsating and tugging on the strings. Okay. Once you get past the papillary muscles, you have trabeculae carnae down here. So you have two different types of tissue that you need to remember in here. The papillary is where all the chordae tendineae attach, and the trabeculae carnae is everything else down here. This thick muscle tissue that you have, myocardium, that's right. So the left side is a lot thicker than the right side, because the right side, like I said before, is only going to the lungs, and this is going to the whole body. That's right. All right, let's see.
What about the inside, the septum?
Oh,
the eyeball. Oh, and the eyeball too, yeah.
So this is the interventricular septum.
It divides the right and the left. Right?
Yep, yeah, it's dividing the two ventricles. Okay.
The eyeball deal. I couldn't find it.
So the fossa ovalis, is that what you're talking about?
Yep.
So you find the coronary sinus, and you're going to kind of pull that apart. Let me see if I can even find it on here. Okay, this one has a decent one. Okay, so you see that hole? Well, it's not a hole, it's like that white tissue. That's the fossa ovalis. Okay.
It's between the right and left atria.
Yes.
Atria.
Okay. So if you have a baby where this doesn't form correctly, you have the right ventricle, or the right atria, which is getting deoxygenated blood, and the left atria, which has oxygenated blood. They're connected, so nothing's getting done. Okay, because they're connected, all the blood's mixing together. It defeats the purpose. And then we have, if we go into the aorta, remember this is the aorta. So if you go into the aorta, you have, let me find it in here. You have coronary arteries. Okay, so the coronary arteries, you see it? They're going to supply the heart with oxygenated blood. So the heart, just like any muscle, it needs oxygen in order to function. So the coronary arteries are bringing blood from the aorta back into the heart. Okay, so this way it can get to all this muscle tissue to help it keep pumping. Okay. I think this might be the last thing. So you find the pulmonary trunk, and you find the aorta. In between the two, this one's broken, you have the ligamentum arteriosum. All right, that kind of holds the two together, and that's formed, I think, a 3-month-old. Yeah, 3-month-old, still in the belly. That's when that forms. Okay, and that kind of just holds everything together. That one's broken. That one's just non-existent. This one has it. All right, so pulmonary trunk. This is the aorta. This one has a big one, even though it's short. Ligamentum arteriosum.
So it connects the aorta with the
Pulmonary trunk.
pulmonary trunk.
Okay. I think that that's it. Do you see anything on there that I didn't cover? Thank you. No problem.